This is Ali Ajmal, your psychologist. Today we are going to talk about sleep problems. Many people are suffering from sleep issues. Yes, these are sometimes sleep disorders. Many people are taking pills for their sleep on regular basis. Sometimes sleeping pills are effective, but on other times sleeping pills are not that effective. Yes, sleeping pills usually does not cure your sleep issues. Okay, if we discuss about the treatment of sleep problem, before that we need to discuss different kind of sleep problems. Okay, well, sleep problems, sleep disorders are diverse issues. It can take many forms. Sometimes people are facing difficulty falling asleep. They cannot easily sleep. Before sleeping, they take turns for sometimes for hours on their bed, and then they are able to sleep. It's a kind of sleep problem. Yes. Why to waste your precious hours on bed thinking and thinking, and then you would be able to sleep? There is no point in that. This is a sleep problem. Okay. We would talk about second kind of sleep issue. Some people are facing sleep problem that they are usually able to sleep, but they cannot continue their sleep, their healthy pattern of sleep, which is usually from 6 to 8 hours. They just wake up during the night hours, during the odd hours. In short, they are unable to keep their sleep to such a long extent which is normal, which is, by the way, 6 to 8 hours. Okay, if we talk about another kind of sleep issue, many people are into the habit of sleep talking. They just talk in sleep, and sometimes their talk is so abruptive and so frequent that we say that they are creating problem for the people who are sleeping next to them or any other family member. Okay, and we talk about another problem which is, by the way, very misunderstood, that it's sleepwalking. Some people are walk in sleep. People have different stories in different culture that this person is walking in sleep due to different myths. But these are not usually, these myths are not usually, always, by the way, these myths are not correct. Sleepwalking is just a kind of another sleep disorder. Okay, if we say collectively about all of these kind of sleep issues, a few people may have experiencing one kind of sleep problem. It may be difficulty falling asleep or difficulty keeping in continuing sleep, and maybe some people are having problem in their sleepwalking problem and other kind of problem. Well, one thing we should be clear about, that why people are experiencing sleep problem. It can be due to many reasons. Sometimes it is just incidental factor that we are in stress. We are not having some kind of psychological issue, any disorder, but we are having stress. Usually it's a normal pattern that when we are stressed, it's directly effect on our sleep and our eating habit. It's okay. When the stress will be over, the incidental stress, the circumstantial stress, your sleep pattern should be better. But if it is continued, that you are having sleep issue for long time, it's usually because of some kind of disorder. It might be some kind of anxiety, stress disorder, it may be depression, it may be personality problem, it may be schizophrenia, and many more kind of psychological problems. So usually us people who are suffering from some kind of a psychiatric issue, they can feel sleep issues. Okay, and in the third category, there is, by the way, they are in more prevalent category. People are more into the sleep problem because of their emotional issues. Some people are having emotional issues, because of which they are suffering from sleep problem. Even the kids are suffering from sleep issues, sometimes bedwetting and these kind of things due to emotional problems. So sleep is directly connected with the emotional issues. If we talk about the treatment of your sleep issues, first of all, the person who are falling in first category, who are having some kind of incidental and circumstantial stress because of which their sleep is disturbed, so they can improve their sleep through managing their stress. And as this kind of people, this category of people are suffering from no issue, but it's just circumstantial stress. So you can cure your circumstantial stress. You can manage it through walk. You should do some exercise. You should reduce your tobacco taking and your caffeine drinks. All these things will lessen your stress, and you can improve your thinking through meditation. And this is good for, by the way, our circumstantial stress, and it will improve your quality of your sleep. Okay, if we talk about the second kind of people who are suffering from some disorder and because of which their sleep is disturbed, so their sleep will not be better through using sleeping pills. Rather, I would suggest that you should treat your disorder. It may be depression, it may be anxiety, and many more kind of psychological disorder. Okay, in the third category, people who are having some emotional problems and because of which their sleep is disturbed, again, your solution of your emotional problem is therapy. You should consult some psychologist so your emotional problems can be treated and your sleep would be improved after treating this problem. Okay, one thing I would like to stress on it. Well, sleep is a blessing. Sleep is, there is no substitute of good sleep in human life. It's a vicious cycle. If you are having some problem, your sleep may be affected, and because of your sleep is affected, you may have many more problems. So it's a vicious cycle. If your sleep is good, it will be work as a shield against many problems. But if it is not better, it will bring more problems in your life. So I suggest that if you are having any kind of sleep issue, you must cure it. You must consult some psychologist. Okay, if you want to consult me for your sleeping issues, or if you want to consult me regarding any of your mental health problem, you can consult me through following given number. Yes, you can contact me to following given number, and I'll try my best to treat your condition. You can have an appointment on my clinic, and you can also have an appointment, an online appointment. Thank you very much. Take care of yourself.